Bismillahirrahmanirrahim. I am Dr. Manzoor Malik, eye surgeon from Al-Shifa Eye Hospital, Bahawalpur. Today I am going to explain keratoconus, which is an important eye disease in which cornea becomes thin and conical. Normal shape of the cornea, this anterior part of the eye, which is shown to be black, is known as cornea, and the adjacent part, which is the white of the eye, is known as sclera. So this cornea is usually convex in shape, but in this disease of keratoconus, this becomes conical in shape, it protrudes anteriorly and it attains the shape of a cone due to thinning of the central and paracentral part of the cornea. So this disease is very common in young people. It usually starts at the age of 7-8 years and may present during teenage and sometimes later in 30s and 40 years of age. So usually it presents at the age of between 13 to 20, and sometimes it progresses and leads to complications which lead to even reduction of vision. And the sign and symptoms of this disease is, as there is thinning and protrusion of the cornea and it is a progressive disease, there is usually progressive decrease of vision, and there is usually myopia. The patient needs minus glasses along with cylindrical glasses due to anterior protrusion and irregularity of the cornea. There is progressive increase in myopia and astigmatism, with the result vision gets deteriorated and glasses go on changing. Ultimately, patient feels dissatisfaction with the glasses. So for that, we need sometimes after, if the patient feels dissatisfaction with the glasses, we need hard contact lenses to smoothen the surface of the cornea and to get better vision. And if the disease progresses, hard contact lenses even don't satisfy the patient, then we may need its further treatment, which could be collagen cross-linking to stop the disease, to halt the disease. In collagen cross-linking, the process of hardening of the cornea and stoppage of the disease progress is attained with the help of this cross-linking, but the disease is not totally cured. Cross-linking only stops the progression of the conical shape of the cornea, and ultimately patient may need contact lenses or glasses along with cross-linking. So sometimes due to progression of the disease, there is thinning and rupture of the corneal layers, which leads to water accumulation. The condition is known as hydrops cornea, corneal hydrops, water accumulation in the central part of the cornea. If there is accumulation of water here, then vision very badly deteriorates, and this water accumulation ultimately leads to scar formation, and there is whitening of the central part of the cornea. There is opacity in the central part of the cornea, and ultimately this opacity leads to greater reduction of vision, and ultimately for that we need to change the cornea. We need to transplant and change the cornea and replace it with human cornea. So ultimately, if the disease progresses, if it leads to corneal opacification or the disease progression leads to deterioration of vision, then we may need the corneal transplantation in this disease. And this disease is usually associated with other diseases of the eye or disease of the body, some systemic diseases. The diseases of the eye having the vernal keratoconjunctivitis. In a case of child having keratoconjunctivitis, there is lot incidence of keratoconus. It is more incidence of keratoconus in cases of vernal keratoconjunctivitis. Number one, due to disease process itself, and number two, due to rubbing of the eye. So the patients having smaller amount of keratoconus are advised not to rub their eyes. And other association of the eye may be some other diseases, just like Marfan syndrome, Down syndrome, or Turner syndrome, which are systemic problems. Or it could be present in case of atopic diseases, in patients of hay fever or eczema, those patients having allergy in their bodies. There is also great association of keratoconus in those people. And there is a lot of association between keratoconus and vernal keratoconjunctivitis in children. So the patients are advised not to rub their eyes, and if there is progressive increase in myopia, mean minus glasses, and astigmatism, they must consult their doctor to have more investigation to diagnose if there is presence of keratoconus in those people. If that keratoconus is diagnosed well in time, you can prevent that with the help of some precautions, just like not rubbing the eyes. Moreover, with the treatment, and among the treatment, in progression of the cases, we can do collagen cross-linking to stop the disease process and to avoid complications like corneal opacity and ultimate reduction of vision. So I think you will like these informations. And among the treatment, we preferably initially start with glasses. If it is not managed or the patient is not satisfied with the glasses, we may go for hard contact lenses. And in advanced cases, if hard contact lenses are not doing well, we can go for intracorneal segments which are intact, intracorneal ring segments, which are again introduced into the corneal stroma to make better shape of the cornea and to reduce astigmatism and a bit myopia. So if the intacts or intracorneal ring segments don't work, then we can go for keratoplasty, which corneal transplantation, which could be lamellar, partial, or it could be full thickness penetrating keratoplasty. That means corneal transplantation, corneal change of cornea with the donor cornea, corneal material. So that is the disease introduction and information. I think you will like to know this information. If anybody in your family is suffering from this problem, you must contact your eye specialist so that you can deal with your disease well in time. Assalamu alaikum wa rahmatullah.